Health insurers' profitability shift. Winners, losers emerge in 2025. Health insurers are making bold moves, and the results are starting to show. Picture a high-stakes race. Some of the biggest companies are scrambling to shed members that cost more than they bring in. And we're just now seeing which strategies are paying off. Just over the past few weeks, the financial results have been dizzying to track. On one side, giants like UnitedHealth Group and Elevance have both dialed down their profit forecasts, signaling trouble ahead. On the flip side, industry peers Humana and CVS Health have surprised investors by actually increasing their profit expectations, while Cigna has chosen to stick to its previously predicted numbers. This rapid back and forth is more than financial drama. It's a peek into the shifting tactics of American health insurance heavyweights. But here's where it gets controversial. It turns out that what's happening in 2025 is largely a consequence of decisions made years earlier. Some insurers apparently saw coming cost pressures and took the decisive, even ruthless step to cut loose certain plans and withdraw from unprofitable areas. Think entire counties or markets. Their portfolios are now leaner, but far more stable and possibly less risky. Others took a slower approach, holding on to loss-making plans for too long, and the financial hit they're feeling now is the direct result. Was it foresight or just a willingness to take tough action? And this is the part most people overlook. While trimming unprofitable members helps stabilize the bottom line, it also sparks debate about access to care. Are insurers doing what's necessary to stay afloat, or are they abandoning vulnerable populations? Is it strategic adaptation or profit-driven neglect? So, where do you stand? Do you think insurance companies are justified in cutting off less profitable members for the sake of their financial health? Or should they be held to a higher standard of coverage, even if it means slimmer profits? This is a loaded issue, and not everyone will agree. Share your perspective below. Do these moves represent smart business, or is something valuable being lost in the quest for profits? Let the conversation begin. Health insurance crisis. UnitedHealth's shocking market collapse explained. Brace yourself. America's health insurance giants are under siege, far more dramatically than most people realize. For years, health insurers have been a favorite punching bag for patients, seen as penny pinchers standing between sick people and care in a notoriously expensive system. Yet for investors, these same companies have always represented safe, almost dull opportunities. Predictable businesses churning out steady profits. But here's where it gets controversial. That image of relentless reliability has suddenly been shattered. Take UnitedHealth Group, the nation's largest insurer. In April, it sent shockwaves through Wall Street by releasing results that were nowhere near what investors expected. Imagine being so rattled that you swap out your CEO and stop making profit promises for the rest of the year. UnitedHealth did exactly that. The latest earnings, announced July 29th, only deepened the gloom. And here's the jaw-dropping statistic. Since last November, UnitedHealth's stock market value has plummeted from $575 billion to $240 billion. That's more than half wiped away in mere months. A collapse few could have predicted from such a supposedly stable titan. And this is the part most folks miss. The entire sector isn't just facing a bad quarter or two. The foundations behind health insurers' traditional steadiness look shakier than ever. What's driving this upheaval? Are these warning signs of a systemic change in how healthcare gets funded and managed in America, or just a blip driven by internal company missteps? Sound off. Are health insurers finally getting what they deserve? Or is this sharp tumble a worrying signal that could hurt patients and consumers too? Where do you stand on the debate? Is more disruption in healthcare good news or bad? Let's see some bold opinions in the comments. Kelly Evans explains the implosion of health insurers. What's happening? Kelly Evans, a prominent co-host of CNBC's Power Lunch, has recently shed light on the alarming performance of health insurance stocks. It's nothing short of astonishing to see how poorly these companies are faring in the market. Centene, a significant player in Obamacare and Medicaid insurance, has seen its stock price plummet by a staggering 57% this month alone. This figure is especially jarring when we consider that its stock price has fallen to levels last seen in 2014, after their recent earnings report. Molina Healthcare, a smaller but heavily Medicaid-focused company, isn't faring much better, with its stock value dropping by 48%. But the downward spiral isn't limited to smaller firms. Even industry giants like Humana, which traded at $550 per share just 3 years ago, are now valued at a mere $235. And it's not just these companies. The troubles extend to UnitedHealth, the largest insurer in the country. UnitedHealth's shares have fallen by 56% from their all-time high last November, a month that also saw the tragic death of its executive Brian Thompson. Adding to the woes, UnitedHealth is currently under federal investigation for its Medicare billing practices. One might be tempted to dismiss UnitedHealth's problems as company-specific, but that wouldn't explain the 29% drop this month in shares of rival Elevance, formerly Anthem, which is also 50% below its September all-time high. According to Mizuho strategist Jared Holes, this is the worst performance the healthcare sector has ever seen, with the possibility of underperforming the SP 500 by 20% or more for the third year in a row. Just own tech, he quipped, suggesting a stark shift in investor preferences. So what's really going on here? Are these declines simply coincidental, or do they signal something deeper? These are not overvalued startups or meme stocks. They're massive, highly regulated entities that are pillars of the US healthcare system. One possible explanation lies in the delayed usage of health insurance services during the pandemic, which made these companies appear more profitable than they really were. Federal investigations into Medicare and Medicare Advantage add another layer of complexity. Moreover, there's the intriguing theory that hospitals might be using AI to encourage insurance companies to approve more patient procedures, potentially driving up costs. For Medicaid and Obamacare, the situation is further complicated by the government's pullback on subsidies and support. The GOP's proposed legislation is expected to significantly reduce the number of people on Obamacare next year, according to the Wall Street Journal. This explains the massive hit to insurers this month. Centene shares did recover somewhat after the CEO's assurance of meaningful margin improvement in 2026 through repricing their marketplace business. However, this implies potential price hikes for consumers, which could face resistance given the already high costs of health insurance, which have been running nearly triple overall inflation over the past 2 decades. Despite these challenges, there are still investors who see value in these companies. Bill Smead, for instance, has begun adding UnitedHealth to his US value fund, citing the government's reliance on these companies. Chris Grisanti of MAI Capital Management has also been a buyer of UnitedHealth. Smead's reasoning is simple. The government needs these companies to exist, making it hard to bet against them. This raises a thought-provoking question. Have these health insurers become too big to fail, as my colleague Brian Sullivan quipped? The answer to this question could have far-reaching implications for both investors and patients. As I prepare to take maternity leave, I can't help but reflect on the future of healthcare in America. Will these companies continue to be the indispensable pillars of our healthcare system, or will we see a seismic shift in the industry? Only time will tell.